Hello everyone, and I'm very glad to present in front of you my PhD thesis titled New Insights on Pharmacokinetic and Pharmacodynamic Changes of Drugs in Varied Gravitational Environments. Just a few words about me. I'm a pharmacist and a PhD student in the first year in Semmelweis University and Center for Translational Medicine. My vision is to enhance drug effectiveness in space, while to achieve this, the mission is conducting innovative research to optimize drug utilization in space travel. I have 3 ongoing projects or specific goals right now, and the first one is the effect of different gravity levels on pharmacokinetics and pharmacodynamics of drugs, where together with my team, we will conduct this through a systematic review and meta-analysis. Now comes the very first and important question: why exactly this research? Well, the use of medicines in space travel is steadily increasing, and also the longer journeys that we take, they carry a higher risk of diseases, and therefore we will need a larger onboard medication supply. And also, we already know that microgravity induces such physiological changes that could have an effect on pharmacokinetics and pharmacodynamics of drugs. So what? Well, if pharmacokinetics and pharmacodynamics of drugs are affected, it can result in reduced effectiveness or worse, intoxication, and this can pose a threat to the lives of the crew. That's why our aim is to comprehensively understand the precise effect of varying gravity levels on pharmacokinetics and pharmacodynamics, and therefore we can suggest necessary interventions accordingly. To achieve our aim, we have a clinical question, which is: do different levels of gravity affect the pharmacokinetics and dynamics of the drugs? And to answer this question, we have a PICO framework where the population is healthy humans receiving pharmaceutical treatment. Interventions include space traveling or microgravity models, or both, compared to Earth gravity, and the outcomes would be change pharmacokinetic and dynamic profile. The hypothesis, which we expect to be true, is that drugs under effect of microgravity will experience changes in ADME profile, so absorption, distribution, metabolism, and excretion, and also the dynamics of the drug, and this can lead to either intoxication or ineffectiveness. If our hypothesis is true, then we have this clinical or research implication, which is to optimize the treatment and prevent the harm in astronauts. We did a systematic research in 5 different databases, and with this search key, which is contained by 2 domains, the first one referring to pharmacology and the second one referring to microgravity and space. There are some of my key articles. They perfectly fit to our PICO, and there are different types of studies done in ISS or International Space Station, or in Earth, so ANA, anti-orthostatic hypokinesia, which is a microgravity model, or there are also studies that include both of them. In our flowchart of selection, we had it around 10,000 articles in the beginning. Then after duplicate removal, we got down to 5,960. Then with title abstract selection, we got to 56 articles, which will go through full text selection. So we submitted our Prospero, done the duplicate removal, done the title abstract selection, and right now we just started the full text selection. The second project is actually with the same background, but in this time we will assess the effect of different gravity levels on pharmacokinetics and pharmacodynamics of drugs, but in this case, in animal models. This will be, again, a systematic review and meta-analysis. In this case, we will focus on either microgravity models on animals, which you can see in the left side, which is the so-called tailed suspended model, or in your right side, there's an animal that actually went to space traveling. And our aim is to do a translational research, so to translate our findings in animal models to human application and understanding. We have the same clinical question and the same hypothesis, just the previous one, but in this case, the population is animals receiving pharmaceutical treatment, and if our hypothesis here is true, we have the clinical or research implication, which is to translate the findings to human understanding and minimize the risk and improve the safety of treatment in space. We did systematic research in 5 different databases with this search key, which includes the 3 domains. The first one is referring to animals, the second one is referring to pharmacology, and the third one is referring to microgravity and space. In our flowchart of selection, we had around 2,600 articles in the beginning. After duplicate removal, we got down to 1,600 articles. We submitted the Prospero and done the duplicate removal, and we plan to start the title abstract selection in the following days. The third project is investigating the effect of spinal cord injury in drug pharmacokinetic changes in humans. And again, this will be a systematic review and meta-analysis. So again, we have a very important question: why exactly this research? while the prevalence of spinal cord injury is increasing, and you can see that globally in the 2019, it was at around 21,000 new patients with spinal cord injury per year. And we also already know that spinal cord injury is known to induce complex pharmacokinetic alterations, and this can impact drug metabolism and distribution, but not alone. It can impact also absorption and excretion. And understanding these effects is important, fundamental, and vital because they can pose a risk to the patient's safety, and also they can reduce the effectiveness of our medication. That's why our aim is to uncover the link between spinal cord injury and drug pharmacokinetic changes, and therefore we can offer insights for improved clinical practices. To achieve our aim, we have the clinical question, which is, how does spinal cord injury influence the drug pharmacokinetics? And to answer the question, we have a PACO framework, which is the population is humans receiving pharmaceutical treatment, exposure is spinal cord injury compared to the healthy humans, and the outcome would be altered pharmacokinetics. The hypothesis is that spinal cord injury affects drug pharmacokinetics, and this can potentially influence clinical outcomes. And if our hypothesis is true, then we have the clinical or research implication, which is to optimize drug dosing strategies in spinal cord injury and enhance healthcare outcomes. To summarize, I have 3 ongoing projects. The first one referring to the effect of microgravity on the pharmacokinetics and dynamics of drugs in humans and animals. We plan to submit both of them on June 2024, while the third one, which assesses the effect of spinal cord injury in the pharmacokinetics, we plan to submit it on September 2024. I would like to conclude my presentation with the Albert St. George's quote, "Science is to see what everyone has seen, but think what no one else has thought." Thank you very much for your attention.
Congratulations, nice presentation. Very interesting topic because it's not a general field for everybody, I think. What kind of medication and drugs will you focus on, or generally, are you thinking about the pharmacokinetical, pharmacodynamical effect of the drugs in the space, in the rat models and in the human conditions? What is the main goal? What kind of medication?
Well, regarding the systematic review, it can be a lot of different drugs that different studies evaluated regarding different diseases. But when we're talking about the meta-analysis, then we will focus on acetaminophen or paracetamol because acetaminophen, because there are enough data, enough articles to do that are comparable to do a meta-analysis. But for the, as I mentioned, for the systematic review, it will be a large systematic review with a high number of drugs evaluated in space and in microgravity models, of course.
How many articles do you wait from the animal models?
For the, I think it has to be at around, we haven't done the selection yet, but maybe 30 to 40.
Mm-hmm. Okay, thank you. Any question from the floor?
Sorry, thank you. I'm just curious, during space travel, during the astronauts' travel, does any pharmacological toxical side effects occur, which we know because of the drugs which they received was in the so-called normal dosage, but in space they have some serious adverse effects? So do we know any data about it, or do they make a case report or something like that?
Thank you very much for your question. It's actually a very good question. That's actually our goal that we want, because there's no meta or done until now in this case to evaluate this. But of course, since there have to be pharmacokinetic and pharmacodynamic alterations during space travel, it can lead, as I said, to reduced ineffectiveness or intoxication. And this, the second one, it can be worse. And that's why we want to evaluate and research further this impact that they can have. But yes, in the current articles, there are cases, not case reports, but those studies that have been done in space. While space traveling, there have been some pharmacokinetic alterations.
Is the tail test model accepted model for microgravity? It doesn't look good.
It is a microgravity model because it simulates the position or the posture of the body that it's actually during space travel, and it's done in animals, actually more in rats.
And for how long they are, hanged up?
It depends on the study, but usually, for example, they put animals in the model, then the animals take the pharmaceutical intervention, and usually around 2 days. And in these 2 days, you get the samples in multiple time points and do the measurements.
Hello. I find all of your topics interesting, but what is more, I'm an anesthetist, and what intrigues me the most is the spinal cord injury topic, how pharmacokinetics change. What I can think of in general clinical practice is when we use a spinal anesthesia, we generally do a sort of a spinal cord injury with the bupivacaine. So what do you expect? Because the most common is the hemodynamic change. So what aspects of the pharmacokinetics would you consider it to be changed by a permanent spinal cord injury?
Yeah, thank you. Well, the third project is actually still in the feasibility check project phase, but we actually know that spinal cord injury induces different physiological changes. For example, there can be impact in the gastric emptying, and then that can reduce the absorption. Or we have the other case when, due to spinal cord injury, we have a reduced muscle mass, and we have the reduced muscle mass, it will impact the drug absorption in intramuscular injection. Or we have different cases when spinal cord injury patients take a lot of laxatives because of the gastric emptying, and we know the laxatives can impact pharmacokinetics of the drugs. Then spinal cord injury can affect the excretion of the drugs, and that can lead to accumulation and intoxication of the drug. So these are some points. And actually there's a very important thing that can relate to my other projects is for spinal cord injury patients that are bedridden. So the bed rest model is actually a model of microgravity, and it can indirectly relate to the space projects. So these are some key points that we plan to focus, but as I mentioned, is still in the feasibility check.